This session we will talk about what's the open data do we need to convince the government to fund the justice reinvestment programs. This presentation will be given by Emma Davidson. Now let's welcome Emma to give us open justice within justice reinvestment framework. Welcome to the stage.
Thanks. So I'm just going to start with a quick content warning. Because we're going to be talking about people in the prison system, this means that we are also going to be talking a bit about mental health, drug and alcohol issues, about trauma and violence. We won't be talking about those things in a lot of detail, but they are interconnected. So if you feel at all that this is not the talk for you, there are still some great talks going on in City Rooms 1 and 2, and I won't be offended if you feel the need to go and listen to one of those talks instead. But otherwise, I guess I should actually begin. I should also mention I will be leaving heaps of time at the end for questions, so I'm really hoping that you've got questions that you want to talk about. Okay, so Tay in the language of the Bangarang country where I grew up, Yuma in the Ngunnawal language of the place that's now my home, Nina Mani in the language of Ghana country, and in Auslan, hello. So I'm just going to do a little bit in Auslan just for a few moments, and I beg your patience for that. Today we are gathering on Kaurna country, my finger spelling is terrible, Kaurna country in Tartania. We always respect elders, female and male. This always was and always will be Aboriginal land, and sovereignty was never ceded. I know that there are many people and families who have a connection to this region. To become a truly reconciled nation, to be able to care for country and for each other, we must listen to, understand and support our First Nations people. This is why I support truth, treaty and an Indigenous voice to Parliament, and that work will continue. So I pay my respects to First Nations elders, past, present and future, and I also acknowledge any Aboriginal or Torres Strait Islander people who are here with us today. Now, the reason why I do that in Auslan as well is because when you're starting a talk and you want to welcome everyone in, you really want to make sure that you genuinely are trying to make this space somewhere that everyone feels comfortable to talk. So that's where you can find me online. To be perfectly honest, if you're talking to me on TikTok, Instagram or Facebook, it may be days before I get back to you on DM. They're not things that I check into regularly. If you're talking to me on Mastodon, you'll probably get a much faster response. It'll be like, depending on my mood, sometimes minutes. I'm on there a lot more frequently. So from the 3rd of November 2020 until the 5th of November 2024, I was the ACT Minister for Corrections and Justice Health, Minister for Mental Health, Minister for Population Health, Minister for Community Services, Seniors and Veterans, ACT Green Spokesperson for Disability, for Prevention of Domestic and Family Violence and Digital Technology. Within population health, I had responsibility for things like drug and alcohol services, pill testing, STIs, not personally, just making sure that everyone knows how to prevent, test for and get treated. Climate change impacts on health, pandemic preparation and COVID. Until December of 2023, I was also the Minister for Disability and Minister responsible for Youth Justice. Before that, I worked as a researcher and an advocate in social determinants of health and criminogenic pathways, and as an open source software developer and IT manager including as Director of Information Management at Navy during the Afghanistan and Iraq wars. I've been a volunteer worker and a radical love activist for most of my life, and it might sound a little bit like some of those things that I just said don't fit together neatly in a jigsaw puzzle, but it just means that I'm very comfortable with cognitive dissonance. Now, in 2019, the UN Committee on the Rights of the Child recommended that all states raise the minimum age of criminal responsibility to at least 14 years. Children under 14 years are not developmentally capable of forming criminal intent for any criminal offence. Neurologically, they are not capable of forming criminal intent. And yet, in Australia, most jurisdictions still lock up children as young as 10 for criminal offences. Now, in the ACT, while I was Youth Justice Minister, minimum age was raised to 12 years with effect from 22 November 2023 and to 14 years with effect from 1 July 2025. So even though it hasn't come into effect yet, we've legislated it, they can't stop us now, it's happening, it's done, we're doing it. In the Northern Territory, thank you. In the Northern Territory, the current government are seeking to wind back the minimum age from 12 years to 10 years. In Queensland, they've suspended their human rights legislation to enable children as young as 10 to be imprisoned in adult watch houses because their youth detention centres are full. So let me tell you about the data that persuaded the ACT to invest in health and social services instead of jailing 10-year-olds. Professor Morag MacArthur's report to ACT government on 10 to 13-year-olds in youth detention in the ACT was published on 11 October 2021. It showed that 90% had experienced domestic and family violence. 17% had experienced the loss of a parent. 58% engaged in regular or harmful substance abuse. 33% had moderate to extreme sexualised behaviour, usually as a result of having been a victim of abuse. 58% had moderate to severe developmental delay or disability. And that can include emotional dysregulation, anger management issues, dyslexia, dyspraxia and non-verbalism. 72% had been suspended or expelled from school. 66% had moderate to significant mental health symptoms that limited normal functioning, and 38% had suicidal ideation or a suicide attempt, but only 33% had received a mental health diagnosis. 71% were not subject to a child protection order in the previous 12 months, and 2/3 of 10 to 13-year-olds in the youth justice system had never before come to the attention of police or had a child protection order. So these are families who've disengaged from the system, and they are experts at slipping under the radar, and most children in youth detention will end up in the adult justice system. So this is the actual screenshot of the infographic that was included in a brief to me as the relevant minister to take into Cabinet to advocate for why we wanted to invest in health and social services for our children rather than jailing them. And I want you to keep in mind that all of those stats that I just read out, they're specifically about 10 to 13-year-old children in a city in Australia that has the highest average income, the highest education level. During COVID, it also had the world's highest vaccination rate. This is a city that prides itself on, making good informed decisions, and yet we still have those kind of outcomes. Now, the MacArthur report showed that 33% of those 10 to 13-year-olds in prison were Indigenous, vastly overrepresented compared to the population in our city. Aboriginal and Torres Strait Islander children talked about systemic racism experiences in education, with police and child protection. But they also talked about positive experiences in programs led by Aboriginal elders. Other studies tell us that 100% of young people in the ACT's Youth Detention Centre would benefit from allied health services. So that's things like speech therapy, occupational therapy, psychology, counselling. But there are limited services in the community, and NDIS plans have been restricted even more since the end of 2023. NDIA reports show that Aboriginal and Torres Strait Islander people are more likely to experience disability but less likely to have an NDIS plan and likely to have a lower level of resourcing if they do have a plan. We only started screening for disability on entry into our youth detention centre in the past 4 years, and we started even later in the adult prison. Now, we don't know how many people in the ACT justice system have FASD or trauma or complex PTSD or ADHD or autism. And yet, even without this quantitative data, qualitative research shows that a significant number of people find out they have a disability for the first time in their life when they're in prison, and that their disability contributed to their offending behaviour because it was untreated. We know that gambling contributes to offending behaviour, including theft and domestic and family violence. In September of 2024, at least 8 or 9 of the 420 people in the ACT's prison said gambling was a contributing factor to their offending. Now, according to a study that was published in the Journal of the Society for the Study of Addiction on 21 August 2024, Australians lose more money on gambling per capita than any other country in the world, and 90% of that is spent on pokies. Now, gambling has real impacts across our community, and according to the study, each 10% increase in annual gambling expenditure in New South Wales is associated with a 7.4% increase in assaults, a 10.5% increase in break and enter dwelling offences, a 10.3% increase in break and enter non-dwelling offences, an 11% increase in motor vehicle theft, an 8.2% increase in stealing from motor vehicles, and a 7.4% increase in fraud offences. So this quantifying of criminogenic factors is the kind of information that governments need in order to decide what to invest in, what programs are likely to reduce the number of pokies machines in the community, and how might that change the number of people who end up in the prison system or who are victims of crime. The social determinants for criminal offending are often intertwined, and they occur in intergenerational cycles. So I've seen briefs about whole families where dad's in prison, mum's in the mental health system, and their child is in youth detention, where multiple government agencies are briefing me about the same family in completely siloed, disconnected, separate briefs. So I get a brief about dad, and from someone else I get a brief about mum, and from someone else I get a brief about their child, and actually it's all interconnected. So this is a quote from a report by the ACT NGO Women's Health Matters 2009 report, ACT Women in Prisons, which has the words, the qualitative data from women in the ACT's prison. I see a lot of myself in her. The choices she makes, her feelings of less than, her total lack of self-worth, it's the same as I was in my life. Now, the trauma and abuse that many of these women experienced as children leads to mental ill health, addiction, and increases the likelihood of domestic violence in their adult relationships. And similarly for men, unmet health and social services and housing needs can lead to criminal offending and prison. Unmet needs that lead to incarceration can lead down many dark paths. Mental health research tells us that we could prevent more than 1/3 of suicides if we could reduce the incidence of childhood abuse that leads to trauma. Research from the ABS tells us that the most common risk factors for suicide or accidental death, such as from drug overdose, are past self-harm, relationship breakdown, and loss and grief. So we are a society that is paying for our inability to understand and recover from trauma in our hospitals and prisons. And to go back to what Justin was saying in the keynote this morning, a system's purpose is? Yes. So in his book, My Year of Living Vulnerably, Rick Morton asked, can we even teach an institution to love? Now, the MacArthur report said that we need a multi-therapy panel that can holistically address drug and alcohol dependence, mental illness and trauma, domestic and family violence, family relationship difficulties, homelessness and disability in both young people and their families and their carers. And that is what we've put in place as part of raising minimum age, including panel members who are Aboriginal and Torres Strait Islander, deciding what therapeutic supports the young person might need. In 2022, we funded AusChild to work with young people and their families and carers on family relationships and trauma to reduce youth offending. In 2024, we started a parenting program at the adult prison, a national first for both mums and dads, that's delivered by Shine for Kids, including playgroup, parenting skills, and parents recording bedtime stories for audio playback to their kids. Now, people in prison tell us that the strongest driver that they have for changing their life is their family. They want to get out, they want to have a safe home, they want to get healthy and stay healthy, and they want to be a good mum or dad. Now, one of the dads in the playgroup was holding his toddler who'd fallen asleep on his shoulder after story time one day, and he turned to the playgroup leader and he said, "I can feel his heartbeat against my chest. I feel like a dad again." Having playgroup in the prison where corrections officers can see that changing how people feel changes how they act, that's how you teach an institution to love. Also in 2022, ACT government funded Thoroughly, an Aboriginal community-controlled health organisation, to provide a new Aboriginal and Torres Strait Islander suicide prevention, intervention, postvention and aftercare program. Now, we already had a universal suicide postvention program, the Wayback Service. Wayback is a great name for things. The Wayback Service is provided by Woden Community Services, but we wanted something that was culturally specific and Aboriginal-led. And especially now, after the entire country debating the human rights of Aboriginal and Torres Strait Islander people to be recognised in our Constitution as our first people. We increased funding and support for an Aboriginal community-controlled health organisation, Winunganimidija, who do something quite unique in Australia. They deliver mental health services and health services generally into the adult prison, including psychologists and nurses. But they also run a community clinic with the same health workers providing continuity of care, and they treat whole families. We started a dialectical behaviour therapy program for new mums with emotional dysregulation, including circles of support to bring in mum's family or carers, because it takes a village to raise a child. And the pilot program was so successful that those mums went out and got matching tattoos of the logo from the Independent Evaluation Report. I don't know of any other mental health program that has ever had that kind of impact, but those mums that participated in that program did something amazing. They invested the time in themselves and in future generations to break cycles. We opened an adolescent mental health inpatient ward at the Canberra Hospital, and we doubled the floor space in a new child and adolescent mental health services community health centre. Young people and their carers, as well as healthcare providers, were a big part of the design process for both the hospital and community health service buildings, because lived experience matters. We opened a step-up, step-down residential mental health service for people who are not yet at the point where they need a hospital inpatient stay, but they're not getting any better with just psychologist and psychiatrist appointments. And when they go home, they have another 4 weeks of community-delivered mental health support from the same NGO that provides the Wayback Suicide Postvention Service. We also increased funding for the Wayback Service so it could see twice as many people. And we opened a safe haven mental health drop-in service and Australia's first public health residential treatment centre for eating disorders. We made improvements to our forensic mental health inpatient services overseen by an independent board, including representation from people with lived experience and their carers. Because better managing trauma and mental illness can reduce justice system contact. We opened Ruby's Place for young people who are too young for adult homelessness services, but they won't engage with the child protection system for foster care. And this is one of those things that I was talking about earlier when I said 2/3 of those 10 to 13-year-olds that end up in the youth justice system, they're from families who are really expert at slipping under the radar and not ending up in the child protection system or with police previously. Ruby's Place enables and supports them to continue with education, to rebuild family relationships, and it provides them a safe place to call home for short periods. We also have Franklin House and Narrabundah House for young people on community corrections orders to avoid them having to be sentenced to youth detention simply due to a lack of safe housing. And we have a justice housing program for adults who would otherwise be remanded awaiting trial or unable to be released just because they don't have a safe place to live where they can comply with their bail or their parole conditions. Now, I've talked to men in similar programs in Victoria who said that until they were told they could go into these housing programs, they had been planning to reoffend simply because they knew that they would be sleeping rough or in crisis shelters where it would be hard to avoid drugs and alcohol. And they said that working with their case manager in the Justice Housing Program is the most helpful part. We increased the number of places available for residential drug and alcohol treatment for both adults and young people, including a new service that's under construction right now for an Aboriginal community-controlled health organisation to deliver a First Nations-specific residential rehab service. We funded a pill testing service that engages people in drug harm reduction conversations. We legalised the personal use and growing of cannabis, just not hydro growing. But, if it's in your garden, that's fine. We decriminalised the personal possession of small quantities of illicit drugs, including heroin, methamphetamine, cocaine, MDMA and LSD. And independent research and water testing, I was also the minister responsible for water quality testing, shows that the use of illicit drugs has not increased. But we have had hundreds of people choose to have a conversation with a healthcare worker instead of with police. Now, over the past decade, criminal offences reported to police have decreased from 48,579 in the 2017 calendar year to 33,804 offences in 2023. We've seen reductions in stolen motor vehicles, burglary, property damage, theft and other offences. And we've also seen fewer traffic infringements issued, but we've seen increases in assault and sexual assault. Now, at the same time, we saw increases in people seeking support for mental illness, for drug and alcohol dependence, disability, domestic violence, sexual assault, homelessness and food relief. Homelessness and food relief, because cost of living pressures lead to mental stress, alcohol and drug use and experiences of violence. Despair gives rise to awful things, and the only way to be tough on crime is to be courageous about ending poverty. But to get the funding to invest in those programs, we need the data to convince Treasury that $1 spent on domestic violence, primary prevention or building more public housing will save how many dollars in prison or hospital beds? Hugh Mackay, a social researcher and author, said in 2021 that if just a small room full of people could be just a little more radical in their kindness over the next week, there would be ripples across the whole city. So this is me telling you that Hope Punk really works. It really does. Now, despite crime rates going down, Canberra's youth detention centre and prison are both close to full capacity. Almost every young person in detention is unsentenced, and 50% of people in the adult prison right now are unsentenced. Now, just so you know, the national average is that 29% of people in the prison are on remand. In the ACT, it's 50%. That's higher than the national average. So, Canberra shouldn't congratulate itself too much. We've got some work to do. But it's not evenly spread. Sometimes as much as 70 to 90% of Aboriginal women in prison are unsentenced. Now, if we want to reduce the number of people in prison and reduce the proportion of First Nations people in prison, we need to better understand why we have so many people on remand instead of bail. Why do we have so many people who, when they're in the community, they aren't able to maintain mental wellbeing or reduce drug and alcohol dependence or maintain a housing tenancy or avoid using violence? And we do actually talk to people when they come into the Alexander McConaughey Centre. It's our one prison in the ACT. We have only one, there shall be only one. And it houses every security classification, people who are in there for every offence type, men and women, everything. It's all in this one place. Now, most of these programs are best delivered by health or social services, not corrections officers, and that means that the funding request needs to come from health and social services where the unmet needs are, and not corrections where the costs end up. But governments fund programs within siloed departments, and corrections are measured on the outcome of reducing recidivism, but the programs that are actually the most effective at reducing recidivism are actually funded or delivered by the Community Services Directorate, Housing ACT, ACT Health and Canberra Health Services, not by corrections. And this is where the data problem lies. Identifying which programs in health and social services have the gaps that people are falling through to end up in corrections. So I want to know, for example, how many people were remanded because they were arrested for an offence for which police bail isn't an option. I want to know how many people were remanded by the courts for breaching their bail or parole orders and what the nature of the breach was. Could that person have complied with their orders if they'd had better access to housing or to health or to social services in the community? But even though I was Minister for all the damn things and my friend and colleague Shane was the Attorney General, we still couldn't get agencies to quickly and openly share data with each other so that we could understand the gaps in our community services. Now, we have a wellbeing indicators framework in the ACT that supposedly drives government decision making. So every decision that comes before Cabinet has qualitative data that tells us why it matters. And you know, that infographic that I showed you earlier, that's an example of them trying to help us with that. But without quantifying the return on investment, how many nights in prison could be saved by delivering this service in the community with this other directorate? Measured in dollars, Treasury will always brief against justice reinvestment spending because that is their job. You know, it's kind of like going to your parents and saying, I'd really like more pocket money, please. And your parent going, well, what are you going to spend that on? That is Treasury's job. We have to actually, you know, be able to explain why it's going to be a good idea. Now, mental health policy workers don't report on how many people exit the community mental health service because they've gone into prison. And our child protection system doesn't report on how many people lose custody of their children because they've gone into prison and never get their kids back. But when they do, it's only to their own minister who's measured on their performance on their health or their social services portfolio, not their ability to reduce prison rates. That's actually the job of the corrections minister. Lucky me, I got all of it, so I got to see all of it. That's never happened before in the history of the ACT, that you have one person who gets to see all those things. Now, the Federal Minister for the NDIS in 2024 spoke to media about not wanting the NDIS to provide support for people with intellectual disability exiting the prison system because those people cost too much in the NDIS, as if the prison is a cheaper place to warehouse people that society seems to deem unworthy of health services. Now, if the objective is a safer and healthier community and it's less expensive and produces better outcomes for people to provide community support rather than imprison them, then what are we doing? As a society, what choices are we making? Why are we allowing this disconnected, fragmented decision-making that lacks data to continue? Because we can't quantify the level of difference that justice reinvestment programs can make. And if we can't quantify it, Treasury can't fund it. Now, the one thing that's underpinning justice reinvestment is radical love. The concept that every person is worthy of love, even when their behaviour is challenging, and especially when their behaviour is challenging. Cornel West said that justice is what love looks like in public, just like tenderness is what love feels like in private. I took that photo in Brooklyn in March of 2020. I'd gone over there with this group of Aboriginal and Pacific First Nations women to basically because I had a pass to get into the UN and they didn't, and my job was get them into the party and then they can talk to the people that can make a difference around reducing violence experienced by First Nations women. And then COVID happened. And I knew what I was going into. I once mapped a small pandemic for the Australian Medical Association for one of their digital publications. And so I do actually know that, in March 2020, I was not just going into a bad flu season. But I went anyway, and then I kind of got stuck there. We managed to get all of the First Nations women home straight away, but this was like the week after New York had declared a state of emergency, and I was trapped and I had no way of getting home. I didn't have a plane ticket. I also didn't have a job. I was an unemployed activist then, just as I am now. And I was walking around Brooklyn and I saw that and I went, yes, that is it. That is what we have to be focused on. It's not enough to have the symbolism of a wellbeing indicators framework that tells us why a government decision matters to a particular group. We need to know what that program will save us and how long it will take to make the saving to get it funded. So the words that we use and the language that we use matters. When we're talking to treasurers, quantitative data is the language they understand, and that's what we need to get better at. And that's why open government and justice reinvestment needs people like you who understand data. We need data experts and policymakers who are working in collaboration to get good programs funded. So to use a little bit of Auslan again, and thank you again for your patience with my, skills that I still need to practice a lot. At the end of the day, radical love is kindness that is metal AF. And I'm sorry, I don't know the Auslan for punk, but if anyone out there does know and would like to teach me, I would love to learn, because I only know metal. In Bangarang, Galnya. In Ngunnawal, Jan Yamaba. In Ghana, Natalia. And in English and Auslan, thank you for listening. Any questions?
Hello. So I'm an ACT resident, so I've got a couple of maybe detailed questions. The ACT government does have an open data portal where it's got many useful things like the locations of all the mobile speed cameras. Is the data you're talking about available on that portal? And if it's not, who do I have to talk to as a resident? Who do I have to write to say I want that available so the public and the Greens in Canberra can do that analysis and then present it to the public?
Yeah, and maybe share it with the Justice Reform Initiative. Sorry, I should stand here so that you can hear me. Maybe also share it with the Justice Reform Initiative. I have looked at the Open Data Portal. I have been using it myself for many years to argue for exactly the kinds of things that you're talking about, for better decision making by governments. And those data sets are not in that portal. The Special Minister of State is the person in the ACT who's responsible for the Chief Digital Information Office, and the Open Data Portal is within their admin arrangements. I would have loved to get my hands on that, but yeah, I didn't actually ask for anything specific when I got made a minister. I just said, I'll do the work that needs doing, and I got handed all of the things, but not actually being Minister for Digital Technology. So I had a lot of fun in Cabinet talking about it. I made people's eyes glaze over when I started talking about quantum mechanics and space, but I didn't get to do that. I think Chris Steele is probably the person you want to contact to get those open data sets. And yeah, go to something like GovHack and let's work on a project.
Thank you.
Thanks very much, Emma. I'm also a resident of Canberra, and in the last ACT election, the Liberal Party promised 500 more police because apparently ACT is riddled with crime. No more judges though, but anyway, it's hard, it's great to see people wanting to talk with data and talk to Treasury in numbers, which I agree with, but isn't it hard when we've also got the populists selling tough on crime to at the end of the day, the vote is going to be concerned. How do we communicate that to the people?
Yeah, and I think that's actually where Hope Punk is really important for us, because we've got the evidence that can convince Treasury, and once people start to see a program working, they don't want to lose it. So, for example, once we got the Justice Housing Program up and running, and people could see that, by making sure that people are housed, you can actually reduce their need to do things that are perhaps unsafe for themselves and people around them in order to solve their material need problems. And that actually reduces the workload for police and makes our whole community safer and easier for everyone. And we've now got people who have a pathway to achieving the things that they want to achieve in their life. So once they actually see it in action, they want it to keep going, and we get more funding put into those programs. And that's exactly what happened with that one. We also need people to get out there and talk to your neighbours, talk to the people at your local community sports club that you're a part of, in your scouting groups, at maker spaces where you're hanging out, in your book clubs, about the things that you're seeing and what's really happening out there, because that then means that misinformation loses some of its power, because people are like, actually, someone else has shown me the receipts, and reports of crime are going down, but people ending up in the prison are going up. So if we're having less criminal offences occurring, but people are still ending up in the prison system, then what do we need to fix? No, the ACT's prison is owned and run directly by ACT government. So it's and that's how it needs to stay. We were really quick to sign up to OPCAT, the Optional Protocol Convention on Prevention of Torture. I can't remember the exact name of that abbreviation, but yeah, we want to be as good as we possibly can be at being human rights compliant. And actually, one of the things that is making it hard for us to be a human rights compliant system at the moment is that so many people are in that system on remand, rather than, being out in the community on bail. It makes it harder for us to run that prison in a way where everyone gets access to all the things that they need. Because you have to, there's some basic rules that say you have to, wherever you possibly can, separate people who are sentenced from people on remand. But you also don't want people to end up in isolation and segregation.
I'll be the third Canberran with strong opinions about the ACT government, who happens to be in Adelaide for some reason.
Yeah.
How do you deal with situations where I've had dealings with various parts of the bureaucracy and various people involved in politics where potentially the release of data about a system may not reflect well on them. As activists, from the outside who are trying to persuade people in government to allocate resources towards producing this data and releasing this data and publicising it, how do you do that in cases where it may be against the interests of the people who are currently running the system to do that?
So that's one of those situations where I tried to lead by example. So when people were coming to me saying, hey, I think something's wrong here, show us the data, I would go, yes, here is the data, and yes, you're right, it shows that something is wrong, and can we please have a conversation about how to fix it? And can we bring in people with lived experience, as well as people who are support workers or clinicians, as well as people who are researchers or academics? Can we put all these people in a room together and co-design a solution? So, for example, that's what we did with the problems with our forensic mental health institution that we've got, our forensic mental health hospital. People did bring to my attention, hey, we think something's not right here, because people are experiencing a lot of occupational violence. And the people who were bringing the problem to me were saying the solution here is that we need to have a particular model of care that is more restrictive for people who are in care and that sort of thing. What I did was I set up an independent review, so it gets the politicians out of the room, because politicians are all idiots. Trust me, I know. I am one. And gets people with lived experience and people who are researchers and people who really spend a lot of time working with people who have these experiences to try and work out a good solution. And then after they came back and said, here is the solution, our recommendations are that you do this, 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 I said, yes, I will commit to all of those things. We will do them. I will go and get money from the Treasurer by whatever means necessary, you know, shake him upside down till the coins fall out of his pocket. We did that, and then we got an independent board. Again, take the politicians out of the decision making because they're all idiots. And we got the independent board to make the decision about, have we actually completed that recommendation true to its intent, or did someone just try and tick a box? And we got it done right. And we got it done in less than 12 months.
One last one here. Down here, sorry.
Hi, I'm from far north Queensland, for something different from the...
I'm very sorry.
No, it's actually good. But like Canberra and this room is a bit of a bubble, I think, in a way, and like that's good to, you know, there's a lot of different skills and stuff here, so that's fine to preach to the choir, as it were. But like in, you know, as you said, Queensland had the basically Labor was wiped out. There was a huge swing against them, and a lot of that, I think, was on the tough on crime, youth crime especially message. And as far as I understand, the same sort of thing happened in NT.
Yeah.
Yeah, sorry. The question is basically, I think it's very hard to, for your sort of message to get through to people in a political way. Like, in the lead up to the election, I would listen to an expert on ABC or some interview go on for half an hour about, you know, sort of the things you're talking about with regard to youth justice. And it would go over my head as well, because I'm not an expert in that in a lot of ways, versus the kids are committing crimes, let's lock more of them up. So how do you kind of just cut through and, you know, make people understand these better policies help them and work and in simple messages?
That is a really good question, and I wish I knew the answer, because if I did, I probably wouldn't be here right now. I'd be preparing for a sitting week. So we had an election at the end of 2024. We pushed the democracy reset button and we turned the system off and then on again. And when we turned it back on again, I wasn't in it. Which is, you know, that is that difficulty about selling the story. My electorate moved further to the right, which meant that I out here on the... I got to say I am probably on the far left, you know, like I don't know many other government ministers who spend their weekends, you know, literally paddling out in kayaks, stopping coal ships or, you know, that kind of thing. But that's who I am, and I can't pretend that I think that employing another 500 police is going to make our community safer when all of the data and evidence tells us that looking after people's actual needs in health and social services and housing, that's actually what matters, and social cohesion. So if we could maybe combine what we've learned out of the talk on Hope Punk, about the talk on digital exclusion, because there's a whole lot of people out there whose only information sources coming in are media, commercial mainstream media sources that, you know, are perhaps not giving them the full picture. And you know, what I've been talking about here, if we could combine those things and find some ways to share with people real information about what works, what's positive, what actually will help us to solve some of these problems, and how can we work together. And there is a talk on Wednesday about building empathy in teams. That in fact, it's a tutorial or a... Yeah, just a talk. But yeah, if we could, you know, like maybe pay some attention to that one as well, because that building empathy part, that's a key part of what makes the Hope Punk movement work, and it makes that sharing of information work more effectively.
We do have time for one more. Emma, are you going to be around for the rest of the event?
I am indeed. I am loving being an activist again, because it means I get to stay here for as long as I wanted. Last time I came to Everything Open, I only got to come for one day, and it was a battle to...
I think you're going to be a busy lady over the next few days.
Oh, I hope so.
Hi, thank you. That was really great. I just wanted to ask, and I totally agree with you that we need data to tell these stories, to get funding in the right places. But something that is kind of a concern for our Indigenous communities in New Zealand is the way that Indigenous data has been weaponised by governments against them. And so how can we trust governments to receive this data and use it to tell the right stories rather than use it to spin a narrative? You know, for example, some of these data points, while for us they demonstrate systemic failures, it could be spun to demonstrate, oh, these types of people commit more crime, which is what has been done in the past. So how do we combat that?
That is a great question. I've actually just come back from a couple of weeks in Aotearoa, showing my family how beautiful that place is, and the things that some of your organisations and institutions do there that engages and celebrates the diversity and all the strengths in Maori culture are something that I think Australia could learn a lot from. What I was saying before about language matters, this is one of those times where you can use the fact that politicians are idiots to our advantage as a community. Because what actually happens is the politicians from the major parties, they're a bit bereft of genuine, creative, innovative solutions to some of these big problems. I'm just being honest here. They actually are. And a lot of them are very reliant on what their public service brings to them. This is particularly the case in the ACT. So Canberra people, 36% of the ACT workforce are public servants, and that means that every time you go to a community group, a scouts meetup, a softball comp, a Friday night drinks, the barbecue at a friend's place, there is a fairly good chance you're going to run into some public servants there, and if you can win them over, then we can get some good stuff going. So what happens is those public servants will brief their minister on, hey, if we ran a program on this, it might help to solve the problem. Now, if they can present that program in a way where it sounds like, oh, look, it's not risky, it really will work, this will help, because politicians are also incredibly risk averse. I'm not, and that's why I'm not in that job anymore, because when people say, show me the data that tells me where the problem is, I go, here, have the data. Now, help me work out, how do we change that? How do we change that story? Most politicians won't do that because they might get some bad headlines out of it. So when their public service comes to them with a solution for a program that might change things because it's something that's innovative, it might be, what the politician is seeing is the risk of bad headlines if this doesn't work. Okay, so your public service need to be armed with good evidence and good data so they can say, look, honestly, you'd be really not very smart to not do this. You'd be a fool to not take this opportunity to have this great program that you can say you did. So that's what can help. That's one of those things where we want to get people working in collaboration.
Okay, thank you, everyone. Now it's time for going home. And thank you, Emma.